103, verse 1. Bless the Lord, O my soul, and all that is within me. To be in the midst of such honorable, handsome, and beautiful men and women gathered together under the auspices of Oxygen African Health Forum. Indeed, we were expecting you since the last 5 years. Today, you made it to this program. We thank you all for coming, and from now to about 12 noon, we'll be leading you through a process. Now, I'll hand over finally to Linda to take you through the whole program. I'm out of here. Thank you so much.
Thank you. We have wonderful men among us, and as the program proceeds, we will introduce them individually so we can address them by their names. Thank you. We'll be having our keynote address, our welcome address, by a wonderful woman. I've known her for a while. She's no other person than Mrs. Alberta Robson. She would welcome us and give us the purpose of our gathering.
Good morning, everyone. Esteemed members of the health sector and captains of industry, I extend to you a warm and heartfelt welcome to the Oxygen African Health Forum. On behalf of the board of the Oxygen African Health Forum, Corporate Health Ghana Limited, and Oxygen Health Technologies, Bilbo Africa, Daisy Award Foundation International, I express my deepest gratitude to all of you for joining us today at the Global Forum to mark World Health Day. As we gather here at the British Council in Ghana, Accra, we are reminded of the pressing need to come together to share knowledge, experience, and innovations that will help improve the state of universal health coverage in the WHO Africa region. The Oxygen African Health Forum is going to provide us with a platform to collaborate, learn, and share best practices that will drive progress towards achieving universal health coverage in Africa. We are thrilled to have the Minister of Health or his representative, captains of the industries with us, whose contribution to the health sector are invaluable. This year's theme, the state of universal health coverage in WHO African region, tracking SDG 3, and exploring innovations and digital solutions, highlights the need to track progress towards achieving universal health coverage and to explore innovations and digital solutions that can help us overcome the challenges we face in the health sector. The Oxygen African Health Forum is a game changer in the health sector in Africa. It is a platform that seeks to stimulate collaborations and innovations that will drive progress towards achieving the universal health coverage in Africa. We are excited to launch the Oxygen Health Portal, a digital health marketplace for Africa, which will provide access to innovative and affordable healthcare solutions that are tailored to the needs of African patients. At this maiden event, we are partnering with Daisy Foundation, an international organization that awards nurses globally. We will be recognizing and awarding outstanding contributions of health heroes who have gone above and beyond to make a positive impact on the health sector. 10 outstanding nurses in Ghana and Africa will receive the Daisy Award. Their commitment to excellence and service is a testament to the incredible work that is being done in the health sector in Africa. and we are honored to induct them into the Oxygen African Health Hall of Fame. The Oxygen Hall of Fame is the most prestigious digital directory and profile of the most exceptional health professionals and stakeholders across Africa. Once inducted, the Oxygen African Health Forum and its partners will commit to promoting the impact of inductees locally and internationally as health heroes, so that their names will forever be etched in the annals of history. The forum is intended to serve as a springboard for professionals exchange and stimulate collaborations and digital innovations among health stakeholders in Africa. Africa faces a myriad of health issues and multiple burdens of communicable and non-communicable diseases. The COVID-19 pandemic has further worsened the healthcare system globally and more critically in Africa. The time is now for more innovations and initiatives to build resilience and prepare for the future. Our panel discussions and open forum will be centered around topics such as access to healthcare, challenges of the health system in Africa, best practices across Africa, innovations and digital health system solutions, cybersecurity in the era of digital health, building resilience post-COVID-19 pandemic, achieving integrated service delivery, and opportunities for collaboration. Distinguished guests, we believe that this forum will be a catalyst for change in the health sector in Africa. We look forward to the insights and contributions that will be shared over the next few hours. We thank you for your participation and commitment to the health sector, and we wish you a fruitful and engaging event. Once again, I welcome you all to Oxygen Africa Health Forum, and I hope that you will find this event both inspiring and informative. Thank you.
We just heard from Mrs. Alberta Roxon, former president of Ghana Physiotherapists Association. She's also the chairperson for Ghana Physiotherapists Association Council, and she's the deputy chief physiotherapist. That is her. Our next section, before we hit to the forum, I would like to introduce another person who was just with me. You've heard his voice, but most of us do not know who he is. He is called Apostle Dr. Thomas Ninteko Tego. He is a lecturer, a broadcaster. He is also a former Greater Accra Regional Officer, Nursing and Midwifery Council. He is also a Deputy Director of Nursing Services. Also, he is a motivational speaker, a co-director of the Barinja Consult, and above all, he is the General Board Manager for Oxygen Health Forum. As I said earlier, we'll be introducing some dignitaries among us. We have the former Ambassador of Congo, Central African Republic, former Deputy Ambassador of Belgium, and he's also, that's the same person, he's also the head of the Consular Section Ghana, High Commission London, and acting ambassador for Algeria, Tunisia, Mauritania, and also ambassador. He's also ambassador for a lot of other countries. He's no other person than Ambassador Peter Yankee. Please, if you are here, he has traveled all the way across the globe. We welcome you, sir. We are moving on to the next section. Still in the introduction business, I would welcome our panelists. I'll give give a short profile about themselves, and then we usher into the panel discussion.
Good morning, dear colleagues. I'd like to start by apologizing for not being there in person. This is due to overlapping commitments. Nonetheless, I would like to express my profound gratitude for having invited me and WHO to participate in this very important and timely meeting. It is gratifying to note that the universal health coverage roadmap of Ghana is well aligned with other global initiatives such as the 2030 Sustainable Development Goals and the African Union Agenda 2063, the Astana Declaration on Primary Health Care, and the Universal Healthcare 2030 Compact. And this roadmap is being implemented through the different tools, notably Ghana 4-year Health Sector Medium-Term Strategic Plan. Dear colleagues, 2022 has been a year where most health systems around the world are recovering from the effect of the COVID-19 pandemic. Indeed, COVID-19 has affected the health care system and the progress towards the attainment of the universal health coverage in several ways. These challenges include the difficulty in providing basic and essential health services due to the health systems largely focusing on the response to the pandemic, the fear of infection, and indeed restriction of movement. I hope that we have learned key lessons from the pandemic on how we can build a resilient health system that is able to absorb shocks as well as continue to provide its routine essential services during public health emergencies. According to the Global Monitoring Report on Tracking Universal Health Coverage, while services coverage improved over the last 20 years, the proportion of persons facing financial hardships due to out-of-pocket health spending has increased. With rising poverty and shrinking incomes resulting from the current pandemic and global economic recession, health systems have struggled to provide continuity of health services. The COVID-19 pandemic is likely to halt the progress made towards universal health coverage, particularly among the disadvantaged populations. Distinguished colleagues, universal health coverage seeks to ensure access to a full spectrum of needed quality health services by all individuals without suffering financial hardships. Health systems provide services that can produce substantial improvements in the health of individuals. Indeed, primary health care approach remains a premier approach to addressing health and well-being challenges. Since the Alma Ata Declaration of 1978, it has been interpreted in several ways. However, as a principle, it has remained core to the design of health systems. The centrality was reaffirmed in 2018 when we met again with all the global health actors in Astana, Kazakhstan, to reaffirm primary health care commitment. As you are aware, the United Nations General Assembly adopted the 2030 Sustainable Development Goals with 17 interrelated goals. Under Goal 3, Healthy Lives and Well-being for all at all ages, universal health coverage is the umbrella target. What is the state of universal health coverage in our region or our continent? Since 2015, the World Health Organization and partners have been monitoring country progress on achieving universal health coverage. In December 2021, the World Health Organization reviewed progress on UHC, specifically how health financing policies can support increases in equitable service coverage and improvements in financial protection. While the Service Coverage Index has been improving globally from an average of 45 in 2000 to 68 in 2019, the incidence of catastrophic health spending has been increasing, placing a heavy financial burden on individuals seeking health care. The 2021 review noted that the world was not on track to achieve universal health coverage objectives. In the WHO African region, only 6 member states, namely Algeria, Cabo Verde, Mauritius, Namibia, the Seychelles, and South Africa, have managed to increase service coverage while simultaneously reducing catastrophic health spending. 10 member states, notably Angola, Benin, Cameroon, Cote d'Ivoire, Eswatini, Mauritania, Nigeria, Sierra Leone, Togo, and Uganda, have a very high level of catastrophic health spending, while their service coverage also remains very low. This indicates persistent barriers to access, while people who have access incur high out-of-pocket payments. Although Ghana and 26 other member states in the WHO African region have reported relatively low levels of catastrophic health spending, they still are reporting low service coverage. Distinguished colleagues, the path to attaining universal health coverage has a number of implications for our governments and indeed Ghana. The health sector needs to establish a clear list of interventions that the citizens of the country will and should be able to access without facing financial challenges. In this regard, I am pleased to note that Ghana has prepared its essential health service package. However, a few actions remain, such as the operationalization of the essential health service package, reconciliation of the package with the insurance benefit package, conducting the necessary financial and budgetary implication assessment, and strengthening the existing systems to continuously conduct and evaluate interventions to include in the benefit package. In terms of ensuring financial risk protection, I would like to highlight the urgent need to conduct a national health account study to analyze the expenditure in health, as well as its implication on the lives and livelihoods of individuals. Distinguished colleagues, information availability and use remains key in ensuring an evidence-driven policy guidance for universal health coverage. This is in line with the theme of tracking SDG 3 and exploring innovations and digital solutions. Countries need to shift emphasis from collecting repositories of data and statistics to also building their capacities for analytics and knowledge translation. WHO in our region has the means and ways to support this shift. On its part, Ghana has made progress in drafting the Health Information System Strategy, the ongoing Demographic Health Survey, and indeed the Harmonized Health Facility Assessment. Yet finalization and dissemination for use of the information strategy is, as well as conducting comprehensive review of the health system, are remaining tasks that I would like to request that the country completes. Despite the availability of various policy guidance, it is important that harmonizing and ensuring the interoperability of the different electronic platforms is addressed. As I conclude, I would like to assure you of the World Health Organization's commitment to supporting Ghana attain the Sustainable Development Goal 3, specifically through the full implementation of the Universal Health Coverage Roadmap and indeed translation of the National Health Policy into action. I'd like to wish all of you a fruitful discussion, and I thank you for the invitation. Thank you.
All right, here we go. We'll be talking about the state of universal health coverage in World Health Organization, Africa region, and then we'll be tracking the SDG 3 and exploring innovation and digital solution. So one may ask, what is the SDG 3 about? We have about 17 SDG goals, but we'll be focusing on the third one, which is well-being and then good health. So our discussion will be around the well-being and good health, and also how innovation and technology would be applied in our healthcare services. We have here CNO Emi Akote. She's the CNO of Nursing Audit Kolebu Teaching Hospital. We also have here, I'll give a full profile about them. Then we also have Professor Bello here. He's also from the Department of the Physiotherapy, UG. We also have Dr. Gladys Bruwa-Nyama, Deputy Director of Medical Training and Simulation Center, UGCM. Now, we'll be heading towards our program. I'll usher them in with a short profile about themselves, then we hit the road. Kindly give me some few minutes. The cultural troop we just saw, they are called Sikako Dan. They are from English Mount Rome. They are near the Washing Bay, the bus stop. So you can kindly contact them as and when you need them. Okay, here we go, a whole lot, pardon me. Okay, so I'll call Mrs. Akote. She's the Chief Nursing Officer and Head of the Audit Unit of the Nursing and Midwifery Directorate, Kolebu Teaching Hospital. She has had this appointment for the past 7 years, having been appointed to this position in 2016 as a Chief Nursing Officer for Nursing and Midwifery Audits over the years. She has gained extensive experience in nursing leadership, quality assurance, and regulatory compliance. She has led and managed the team of nursing professionals to ensure compliance with regulatory requirements. This is the person we will be interacting with. Let's usher her in with a round of applause. Please. Thank you so much. Okay, our next person is Professor Bello. Prof, you are welcome once again. Kindly bear with me. So, Professor Bello, as I call him, is an associate professor of the orthopedic musculoskeletal physiotherapy at the University of Ghana and a coordinator of the graduate programs in the Department of Physiotherapy. He is a researcher and clinical educator with a vast experience in the design and evaluation of high-quality academic and rehabilitation programs. His research interests include the modification of physical modalities, including the use of technology, in the remediation of impairments within the physiotherapy practice. Also, Professor Bello is a research fellow of the Stroke and Cardiovascular Research Training and a Foundation Fellow of the Postgraduate Physiotherapy College of Nigeria. He is a mentor of many committees and boards in the University of Ghana and a registrant with Allied Health Professions Council Ghana, as well as a member of various professional associations. Welcome, Professor Bello. She's currently the Deputy Director at the Medical Training and Simulation Center of the University of Ghana Medical Center. She's a public health practitioner with 28 years experience in clinical care, research, training and preventive practice. She holds a PhD in telemedicine and maternal health, as well as master's degree in public health. She is also a state-registered nurse, a midwife, and holds a bachelor's degree in nursing with psychology. Let's welcome her. We are all set to go. Later, we would have a representative from the World Health Organization joining the conversation with us as the panel discussion goes on. I will now call on our moderator for the panel discussion, the General Board Member or Chairman for the Oxygen Health Forum, Dr. Thomas Apostle Nitego Tego, to be with us this morning.
Thank you. Thank you, honorable men and women seated, and thank you, my honorable panelists and guests. I'm so grateful to have all of you, great man and women. It's a pleasure to have me here. I hope you have mics on your... Can we have separate mics, please? Thank you. We all are aware about the issue of healthcare delivery in Ghana and Africa. It's no news to anyone seated here that the insufficiency or inadequacy of healthcare delivery is a problem for Africa and in Ghana in particular. And therefore, Oxygen Health is seeking to bring healthcare delivery to the doorsteps of the citizen. I want to pose my first question, and I believe we normally say women first, today I'll say men first. How, Professor Bello, how do you perceive the current status of access to healthcare services in Ghana and Africa? And what's your opinion, if any, on what can be done to improve accessibility and affordability? Thank you.
Thank you, everyone, and I'm very happy to be part of this auspicious gathering. I want to start from a positive note. Challenges are there, it's always been there, but let us give ourselves a pat on the back. Government has put in a lot of measures to improve these challenges, even though we are not yet there. Okay, I have stated that. Now, the issue goes beyond accessibility. The affordability too are there. within the medical delivery services. There are some healthcare delivery services that are not near sufficiency. Talking of assessing it. And there are many factors, factors that are leading to this. Partly on the part of implementation, because I believe government has a lot of policies in place to address some of these accessibility issues. But because of implementation, or perhaps because of the barrier to such implementations, we're still yielding in some of these problems. I'll give you an example. Why it is better for medical and paramedical healthcare professionals or healthcare professions, it is worse with rehabilitation sciences and other allied sciences. So I think as the discussion goes on, we'll be able to bring in vital information on what and what we can do to
let me just bring your mind to something. You say that government has done enough by making sure that health is accessible to almost the whole part of the country. How would you take this one as a physiotherapist? Do we have the services of rehab in every part of Ghana?
Capital no.
Okay. So how do you intend to make it available?
Yes. The solution to this problem is not a day job, and that is why I started on the positive note. For instance, when I came to Ghana in 2007, we were less than 100 physiotherapists in the whole country. Today we can boast of 300. Yes. When I came, it was only one institution, that University of Ghana, that is training physiotherapists. Now we have 2.5. So, we have 2 establishments.
But they are not going to the Netherlands.
Okay, they are now. Okay. They are now because the internet and all those things have improved, so people can stay anywhere, make a negotiation and network to anywhere they want to make. But at initial stage, it's very difficult. Everybody wants to remain either in Accra or Kumasi.
So you can agree with me that accessibility is still a problem?
It is. In fact, WHO declared openly in 2016 that there is a large unmet need, rehabilitation needs in the whole world, not even to talk of in a low resource setting like ours. Right? So it's an obvious thing. But that is why it's a build-up discussion. That, when you continue to raise challenges in all situations, to harness the solution will be a problem.
Okay, thank you, Prof. Bello. Let me come to you, Dr. Akosia Niyama. What's your view on this same question, accessibility to healthcare across the country in Africa?
Thank you. Universal health coverage actually is a big problem in the global. Ghana is no exception. That is why some implementation related to telemedicine and others were put in place. We haven't gotten there yet. And I'm tempted to say that the private sector is rather doing well than the public sector. And it looks like most people that do have money attend the private sector, leaving out the public sector. This is where the issue is. It looks like if you do not have money, you don't get quality health care. And these are things we have to look at. We haven't gotten there yet, and there are still remedies we need to put in place to achieve some level of universal health care as well as quality health care.
Thank you. Would you agree with me, Madam Amy, that specialist training of health professionals is important, and therefore specialist nurses and midwives as well as other categories of healthcare workers should be available in every part of Ghana? If yes, how do we ensure that?
Thank you very much for this question. Yes, I agree that we really need nurse specialists and especially the trained, those who are trained professionally all over this country. But the question comes again, how do we get them there? When we even look at the funds that we have, looking at their salaries, the motivation comes in. They need to be all over, but they don't have attractive motivation or remuneration to be there. So I think with the limited funds that the government has, yes, we are trying to have them, we are training, the country is training more specialists, but we still need to do something about that.
Touching on that, well, you're looking at the challenges you face in the health industry, right?
Yeah.
What other challenges can you look at?
The other challenges that we can look at is even the limited resources that we have to work with. We can have the specialists all over, but if we don't have the resources to work with, it's like we haven't done anything. So, and also, we still have shortages anyway. So that's one brings in mind that we have a constraint, time constraint. So they don't have even the time because there are so many patients that need to be attended to, but the health professionals are few, and therefore they don't even have time to examine the patients very well. So even though we are training them, we have to look at the resources also.
You are a nurse, right?
Yes, I
What do you want to say about the attitude of nurses towards clients on their first visit to the hospital?
That is a good question. Yeah, looking at the attitude of nurses towards clients in the hospital, I would say that it's not all the nurses that have this bad attitude. And now we are even looking into it, and we are seeing that most of them, it's even coming from the homes. Because even the training institutions are doing their best to give them what they need to have, the customer service that they need to give to the client. And even in the hospital, we are trying to do it. Professionally, nurses are to be nice to patients. It's also part of the therapy.
Let's give it to nurses in Ghana. Thank you. And indeed, Ghana nurses are nice. Looking at the load of work and the numbers. I mean, obviously, when I'm tired in my class, sometimes you find a fun face. It wasn't intentional, but I'm tired and stressed out. Thank you so much. Let's go to Dr. Neoma. Dr. Neoma, you said you have your PhD in telemedicine. How do we ensure digital solutions in the healthcare industry?
Yes, that's correct. Said telemedicine has been piloted in America was and we realized that the most of every death from maternal health, so we implemented that around it.
What is stopping you from doing this one?
It comes, but we just got funds to implement it, so we are setting up strategies to improve it. I think when it is done, the just that we really need to go there to the maximum is to attain some level of good health and
what are some of the strategies to find potential that will face as people when it comes to digital health services? Other than digital health services,
network issues is one very big problem. I think in relation to telemedicine, the role of the community health nurse at that side is supposed to review and refer to somebody at the district level. Sometimes you even need to send images for the physician or consultant to review and then get back to you. In some instances, you send the file and it does not do. Another one is you even make a call separately and it will tell you, even when the person is closer to you, the network will tell you that the number you have for yes, so that's another one. The second one is about consultation. Access to go was a big problem. Even in the market of where it was started. You only one ambulance. If you look at the roads, if you are pregnant and you have to be sent to the district hospital to deliver, you might deliver in your car. because the roads were very, very long. Yes. So at least network issues and road systems as well as transport. These things were the issues that we needed to resolve before we do the nationwide.
So you need to call in the network operators.
Yes.
To tell them we are about to roll out telemedicine. They should do up on their thing. Thank you. And for them, what challenges do you foresee we face in rolling out digital services that are making healthcare accessible across Nigeria?
Okay, thank you very much. We have a subset of the telemedicine, we call it telerehabilitation, which hold the same principle. And I've been leading this founder for the past 3 years. She mentioned funds. Funding has been the issue. But let's take that apart. The digitization of health entails a lot of things, particularly with this area. We are in a society where our literacy level is low. So there's a need for enormous support of tech support, literate support of technology and how to use it, apart from the network she mentioned. Then, more critically, most critically, the acceptance of the client in the realm of rehabilitation. I tell you, in physio, we make maximum contact with the patient. And what they do is the research that we carry out is that patients even near the facility of our topical care is a therapist for you. That you actually want to come and I'm sure you know that the best therapist, the best nurse, the best doctor is the one who can actually bring patient at home. That is sitting in front of the physiotherapist or sitting in front of your doctor, if your problem is 50% solved. If you are meeting very good.
For the benefit of people who are watching this across the globe and in Ghana, I want you to highlight some of the problems that face you tend to solve when it comes to healthcare. What are some of the things you do? Areas of care. That will pass physiotherapy.
Okay, so physiotherapy follows the same path as medicine. What I mean by that is that medicine areas of specialty. I sit down before you this morning as an orthopedic physiotherapist. We have O&G physiotherapists. We have those who specialize in bends and plastic. Madam is one of them. We have those who specialize in stroke, neurology generally, cerebral palsy, children who have delayed development, and so on and so forth. And we have those who are in sports, who deal with sport. So under these branches I give you, there are a whole lot of conditions that I may not be able to exhaust.
When you go to rural areas in Ghana, there are persons who are also undertaking physiotherapy informally. How do you go to rope them in for training like we've done with the TBAs?
Excellent. We had that division in the University of Ghana. In my department, when I was the head of the Department of Physiotherapy, we scout for some of these home-trained therapists because massage is as old as man. Okay, so what we now realize is that, okay, these people are doing human job at the community level. We can't rubbish them. Why can't we invite them to give them some rudimentary training? And that's what we did. So we did that for almost 3 years consecutively until we were not getting, applicants again. And one of them who came for that program actually saw a whole lot of things they are doing very wrong, and they embraced the one they think they have been doing very right. So we have even gone ahead to do that, to correct all the anomalies. For instance, those who are following our athletes, they can cut the careers of our athletes short if they manage their injuries very wrong. So at the University of Ghana, we are back on this program to make sure that for all those informally trained health workers are actually brought to limelight.
Thank you. Let me go to Madam Amy. We find today within the media landscape, and I have particularly referred to TV, you have every kind of person calling himself doctor of herbal medicine. You tune your TV, and they mention leaves and everything. as if they are filling in a gap that the orthodox trained practitioner is not found in. So everybody is becoming a herbal practitioner today, and they are all about parroting their cures. Do you think it's going to be a problem going forward when this gap is not filled immediately, based on the challenges you face as health practitioners?
This is going to be a very big problem. It's already a problem. And I think we need to look at our health promotion area in our public health sector, so that we will also go on advertising or educating, that's the right word, educating our people. Because if the people don't have the right education, then these ones who are always, they are all over, even in the cars, they are there. Immediately you enter a car and you sit down, the next thing after the good morning, they have something for all of you. And they do it with passion. So I know that legally, we the healthcare workers, you can't do that. But our health promotion unit needs to do something about
So do you see a shortfall with health promotion education within the NOH and DHS in Ghana?
Yes.
How do you solve that?
Yeah, solving that is, once we have recognized it that it is a problem, then we need to improve on our health education. And have more people to train to do that and give them the authority to do health.
Thank you, sir. Dr. Niyama, would you agree with me that pastors cover a long range of people, pastors and teachers, and that it's important that the Ministry of Health involve them in health education and empowerment of our masses?
Seriously, it's an area I wouldn't like to venture.
Why?
We have full trust in them. Seriously. Their members do have full trust in them. And whatever they say, that is what the members do. That's why I said it's an area I do not want to venture.
Okay.
However, if you are able to capture the head, the part, you may want to train them, and then they can influence.
So you don't want to talk to them yet, educate them, empower them?
Because I think they listen to them more. Some of, even the women, they adore the pastor than their husbands. So I think they can do it.
All right. On that one also, you are looking at Oxygen African Health Forum today. And today is, fast forward, the World Health Organization celebration day was supposed to be last week Friday. But because of the Easter holidays, we brought it this far. What is your message for the whole world on the World Health Day?
This is a dream come true. That is what I will say. It's a dream come true because I have experienced telemedicine and I know the effect it brought on board, even in Amazon West region. So I was happy I saw digital health work. Initially, it was quite difficult as to the content is going to present. But a quick review indicated that we are on the right route. So let's embrace it, partner with others who are already on board, so we can hold it up and then push it to the highest level.
Thank you. Same question to you, Professor Bello.
Yes, I think I also agree that's the right step in the right direction, because with digital health, we are able to navigate the geographical barrier and partly financial barrier. I couldn't say that fully because it's not being implemented to actually know whether tele-rehabilitation in my own case will be more cost effective or will be equally cost effective like in-person care. But whatever the case, I think by whole assessment, I think it's the right step in the right direction. And there are, like I said earlier on, there are other policies in place that are running. Usually it's always the implementation that's the problem. For instance, community health planning and services. The essence is to empower people, to break most of the barrier, to increase, to improve the assets. It's already in the system. Okay, so we can use all this digital health and which the Oxygen Health Forum has already started combine it with what we have in the systems to improve our lot.
Thank you. Madam Amy, your take on World Health Day and then celebrating Oxygen Health.
Yes, it's a step in the right direction. All that I want to say is that let's invest in that, and I think we will do very well in achieving the universal health coverage.
I am honored to have hosted you, great men and women within the industry of healthcare in Ghana. And in our tradition, you don't invite someone in your home and just let them go. So let me rise up and say thank you for coming. Thank you for coming. And thank you for coming. And to all of you who watch us, we are grateful you are part of this discussion. Soon it will be your time to also ask questions and you have answers from our panelists. Thank you so much. MC, I'll hand over to you.
Hello, nurses of Ghana. It's Earl Dalton. I'm the Chief Nurse Officer here at Health Carousel. And what an incredible honor it is for me to be able to come and talk to you today, all the way from Ohio in the United States, to talk about the African Oxygen event. Years ago, I met Mark and Bonnie Barnes, who, as you know, are the founders of the Daisy Foundation. And here at Health Carousel, we were just so inspired by the work that the Daisy Foundation was doing in the recognition of nurses, not only within the United States, but around the world. You know, the Daisy Award for me symbolizes dedication to our profession, professionalism, incredible acts of caring and compassion. And boy, I'm sure if I got a chance to talk to the winners of the Daisy Award that are present today, I would hear themes of these sorts of things just raining through in the stories that the nurses would tell us. You know, in all of my time, we've given out over 100 Daisy Awards here at Health Carousel. And every single Daisy Award winner, one statement almost reigns supreme every time when I talk to the winners. And they say to me, Earl, I was just doing my job. And that humility, that place where we're just doing what we're supposed to do in the time that we're given with the patient, just rings through over and over again. So, nurses, I have no doubt that today you're humbled by the award. I'm sure that there are hundreds of nurses who do what you do and would just say, "Hey, listen, I'm just doing my job." But you join the ranks of an incredible brethren, those who have won the Daisy Award. As Bonnie points out in her part of this discussion, over 5,000 hospitals are giving out the Daisy Award. They've been doing this over 2 decades now, and have given out over 200,000 nurse recognition moments with the Daisy Award. And so, what an incredible gift Mark and Bonnie Barnes are to the healthcare community, and the Daisy continues to live and shine bright. And so what an honor it is for us to be part of this celebration, making sure that nurses get this fantastic award on behalf of the Daisy Foundation today. You know, as I think about the future of healthcare, certainly as it applies to Africa, really I think you could make this argument for around the world. I think there probably isn't a bigger problem, a bigger challenge to overcome for our future than it does relate to staffing levels. Nursing is a reducing profession. There are less of us now than there used to be. In the future, there will be less of us again. And so as I think about future challenges of nursing in Africa, and certainly in the Ghana region, what I think about are really a couple of things. One, what is the pipeline with your nursing schools, with those that are coming up, maybe emigrating to your country or moving around your country? How are we taking care of the supply of nurses into the future? What an incredible question to answer. If you come up to the answers for that, please go ahead and share it with me, because this is a major problem really for around the world. You know, one of the stats that's bandied about is that there are about 30 million nurses in the entire world. By 2030, we'll be short by half around the world the number of nurses that we need. Leaving us with about somewhere around a 15 million nurse shortfall. So along with procuring a pipeline into the future of nursing, I think this is priority one. Red, we all know that care transacts through the hands of a nurse. Every delivery system around the world, nursing is the centerpiece for a reason. And so we are care in action. So step one, I think, for the future, one of the big challenges that people have to overcome is securing your pipeline. Where are your nurses coming from, and how are you dispersing them around the regions of your country to provide the most care? I think what joins in that, right behind that, it's also the burnout and the mental health of our nurses. Nursing is a hard profession. And anybody who's practiced knows, we give so much to our patients. We have such concern for our patients over time. It's hard. It's hard to keep up with all of the care demands, all of the latest science to be able to provide the very best to our patients. So I think a lot about burnout. And I guess I would challenge the group there today as you think about future challenges within the country. What are you all doing to take care of the caregivers? Because, boy, as we shrink in population and size around the world, as nursing gets smaller, it's going to become more important than ever that we take care of those who are doing this work. And so what are your strategies? How is it that we're taking care of one another and giving care for the caregivers so that burnout, care fatigue, moral distress related to care continues to be on the decline? This is a major problem. And certainly one I think that African nurses will have to deal with as we go forward, which is not that different than the rest of the world. This is a problem I think that we're dealing with all over the world. When I think about solutions to these sorts of problems, I think about a couple of things. First off, what is the mentorship program, the model of entering new nurses who would be novices to our craft, and then moving them up through a model to expert nursing? Right? People want to be successful. They want to succeed. They want to have the tools that they need to do your job well. And so what's in the toolkit for orientation? How are nurses entering into the schools to prepare them for what's ahead as they enter into the profession and actually go care for patients in Ghana? I think making sure that you have the right training and support of new nurses is a critical piece for the future, and something I would certainly recommend that leaders look in on. I think the other big innovation, the other big piece that people are missing around the world that might be really important is care for the leaders. Who will lead us into the future, and are those people okay? And so I would challenge you all with what are your mechanisms to recognize leaders, to check in on leaders? Right? It can be a tough job. It can be a lonely job to be in charge and have to lead people. And so what are the tactics and strategies that you're using there to make sure that group of people are well taken care of and that they can lead effectively over the next 10 years, where we'll have some bumpy times. But you know what? As with all things, nursing is its own gift. Our reward is in the care of our patients and seeing their smiling faces, seeing them overcome tragedy and triumph into the future. And I have no doubt that Ghana is up for the task. And certainly we'll be watching with interest here in the United States as the decades continue to unfold. So take care. Thanks for letting us be part of this incredible event. I'm incredibly inspired and honored to be able to be part of this today. And certainly on behalf of the Daisy Foundation and here at Health Carousel, we just wish you the very best, and thanks for all that you do. Take care.
Thank you so much, our panelists. We are getting interactive now. But before we get interactive, I'd like to acknowledge some few dignitaries among us. I want us to welcome Pastor Charles Asari. He's also a pastor of Powerhouse Foundation Ministry and the Ladies of Substance International. We'll be having a survey for the program. So as time goes on, we will be giving you the direction as to how the survey would be going. We'll do it here before we leave. As we are getting interactive, any question, any suggestion, any mind-boggling issue about health, let's get interactive.
Indeed, I may not have exhausted the questions on your mind, because I don't have access to that. But I'm sure you have something to ask of the panelists today. Now, the doors are opened for you to ask questions, or even there's a contribution you have or suggestion. So everyone within the delegates assembled here, you have access to ask questions of the panelists, or if there's a suggestion you want to make. Thank you. And so, please, let somebody have the
Yes,
mic.
please.
You mentioned your name.
Kindly help us out.
Mention your name and where you are coming from, and then your question or contribution. And we have the person's hand
Can you
up.
help me out with the microphone?
Thank you very much. I'm Dr. Ismail Ibrahim from Muslim Health Workers Association of Ghana. Yeah, Doc, you did ask a question or did say something in relation to herbal medicine. I want to ask, if you look at, let me say, the world or Ghana per se, there are two types of healthcare systems that we practice here. That is orthodox and alternative. And as you said, we mentioned about a problem. So why can't you be, let me say, a collaboration? At least we have these quack doctors, okay, in the system, especially at the herbal side. What are you going to do, at least, so that you can fish out these people, so that it will help? Because within all, not all of them are bad. Others are doing a good job, but it's only few who are becoming problematic. So what are you going to do, at least, so that at least those people can be fished out, so that at least those who are doing the good work also could be motivated, so that they also help, so that we can have a universal health coverage. Thank you very much.
Thank you. So you are calling for regulation of herbal medicine in Ghana, am I right?
Exactly.
Thank you. Can anybody take it from here, please? How do you regulate to fish out the fake ones?
Okay, fishing out the fake one. Anyway, let me just say my own side of the view. We wrote an article, and this idea was coming from the fact that the bone setters in Nigeria, they are very popular. And either we like it or yes, the people find it very easy to go to them. They are very accessible, and they know all the protocols in the hospitals and all those things. And I must also say that if they get it right, particularly if it's the closed fracture, they are all healed faster than the one in the hospital. Yes, because I don't know where they get their link from.
Bone setters are able to heal the patient faster?
That's what I put a condition there. If it is a closed fracture that is not very complicated, very simple fracture, they are all, maybe because of the strength of their leaves and all those things, heal faster. But it becomes a problem when it's a compound fracture. Compound fracture means the fracture that is accompanied with open wounds and all those things, because they may not be able to take care of it. So they have their strength, they have their weakness. And of course, the barrier is always how to integrate the traditional, healing into the orthodox one. For instance, if you break leg, you go to traditional healer. The first thing they will do, one system, is to break a foul leg. Knowing fully well that no fowl will die through breaking of leg. So you are so sure that, first of all, you will not die. So as the foul leg is healing, your own fracture too is healing. Okay? So it's a very big problem how to integrate this. So we recommend make some recommendations. One of these is inviting a neutral body who are neither orthodox practitioner nor traditional practitioner, practitioner, to midwife this integration. Because for orthodox, we write it down, we prove it. In the other case, incantation, we don't know. Ordinary incantation can do a lot. How do you mix some of this together? But I quite agree that there's a need for integration.
So probably do we look at setting up a regulatory council for herbal medicine? And Dr. Nyama, you want to say something?
Yeah.
Oh, there's one now. I like that. Okay, Amy. Oh, you have somebody who is going to help us here. Thank you, sir. Your name and where you're coming from, sir. Can somebody? Okay. Well, I get overwhelmed with the numbers I see from morning to evening on TV. Thank you, sir. Your name and where you're coming from, sir.
My name is Dr. Pafo. I'm acting as the technical coordination.
Thank you and welcome, sir.
have traditional medicine council. Okay, that regulates traditional medicine practice in this country. We have traditional medicine directory. And as the integration is ongoing. If you go to many of the Ghana and facilities, now traditional medicine authority in the same compound. Practices. So if you go there, you pick wherever you want to go. But as you know, in many institutions, you always have, the past. And that's what all of us will come together and fight this cancer. Because you can sit in Accra and somebody can be practicing, somebody will be in Accra. In Ghana, if somebody is doing the wrong thing, you want the policeman to do an arrest him. Nobody wants to report so that they call him a bad person. Okay? So as I have the mic to let you also give my comment.
Yes, sir.
You know, if you look at Ghana, I would say we are blessed. I've worked in the health system for over 30 years. When I qualified as a doctor, we had few graduate nurses. Now we have university training graduate nurses. There was no physiotherapy training. We have graduate physiotherapy. We have graduate lab science. We have the college. So over the years, the federal government has done really well. What we need to do is maybe how to move the health workers and other people to the rural areas. But it's not only Ministry of Health. As somebody was saying, you need access, to the place, roads, schools. If you put the health workers to the village, the first thing will be speak for my kids. We have the people, but how to move them. And what we also don't proud ourselves, you know, we have Ghana was one of the first African countries to have national health insurance. Even though it had challenges, it has made a lot of impact in our health. So we haven't reached there, but I must say we are on the road to achieving some of this universal health coverage. And if we want to talk about universal health coverage in Africa, and we grant countries, then Ghana will be among the first 10 who achieve universal health coverage in Africa. Because we have a lot of this compound ongoing. Recently, I'm not being for that. This agenda 111, if it works. We are on the road to improving access. We are training more specialists. So by and by, we are achieving that. But challenges will always be there, and that's why we are having this digital health alignment. Also, one of them, the private sector is coming on board. So yes, we are achieving, and we want all hands on deck. Thank you very much.
Question of you. Maybe you can take your seat and you said Agenda 111. These are facilities built across the country. But today, as we speak, Ghana faces a drain on its health workforce. People are running to the UK and the US in numbers. The thing is, our salaries are not enough. We are not incentivized and we are not motivated. How is the ministry going to ensure that there will be adequate workforce within the Agenda 111?
You know what? I've worked in the US, I've worked in Europe, I've worked in China. If you go to US now, US doctors are moving to Australia. If you go to UK doctors are moving to US. We Africans are moving to UK, South Africa. So that migration will never stop. Migration will never stop. But when you come to Ghana, how many people 50 years ago, we have only University of Ghana. Now we have 5 public hospitals and then 2 private hospitals. We have nursing training schools across the country. The challenge is the economy is what is also preventing. We have, as we speak, we have about 50,000 nurses registered with nursing and midwifery council that have done in this time. We have some doctors who don't have financial clearance. So if we have funds to employ all these people, I think we can fix most of our papers. So we are hoping if the economy improves, some of these challenges will be solved.
Thank you. Let's give it up to the doctor. Anyone or contribution? There's somebody here.
All right. Thank you very much. I am John Sudata. I work with CSR Stepbury and a PhD student at School of Public Health. Let me start with the traditional herbal medicine stuff. I think we are putting all in one basket. As of now, when you go to tech, there are medical doctors, traditional medical doctors being trained there. And they have established a very authentic institution by which, before they even treat you, you go through the lab system and everything, and which they are really, really doing well. And even some genuine medical doctors, sometimes in certain situations, they can transfer you there. You understand? I think the situation has to do with the regulation, the implementation of policies, and how we can integrate them. With the incantation people, they are totally different. So let's look at the authentic ones that are doing well, encourage them, and put the necessary policy in place and implement them so that they can also play their role. Now we are talking about universal health coverage, and these are key people that I think they can also help in order for us to access health. Aside that, there is a key question you asked concerning key challenges with the physiotherapy. And I think when he was about to answer, there was some interaction. So if you can mention some key challenges that the physiotherapy sector faces, I'll be very glad.
So to you, Professor Barlow, can we have a mic from you, please? Key challenges.
Okay, so key challenges, insufficient training institution, lack of human resources, because of all the three, University of Ghana is the foremost. The qualified physiotherapists, we are not more than 5. And it's a department that's supposed to have at least 15, not more than 5. Not to even talk of the other universities. So another thing is poor pay in the country. The moment they are out, they are out of the country. Like he said, nobody can stop that. Migration is natural. I'm also in Ghana. I'm a Nigerian. I'm in Ghana. It's migration. So you can't stop that. Again, another key one, which we have been able to find solution to now, which will soon start, is the graduate program. Okay, so we have just been given go ahead by the Ghana GTEC to go ahead, and by the grace of God, we are starting this academic session. By the time we are able to roll out that, I'm sure most of this problem will be out of, because some of the other universities, tech doesn't have people, who also are struggling, with these only universities that I can see a little bit, stable, So these are some of the key, and in terms of practice, whatever applies to all other healthcare practitioners also apply, to physiotherapists in terms of challenges. Okay, so and it's lopsided as well. Most of the physiotherapists are found, Kumasi, Accra, maybe Cape Coast, Takrady, all those places I've mentioned, there are about 3 or 4 in those hospitals. For Kolebu, can post about 30, and Align 30. Kofanoche about 10. Okay, so you see that it's lopsided. So also is the services to people. We are all Ghanaians. So why should some people be having and the others are not having? And then one important thing again, my senior, mentioned it, the issue of unemployment because of a lot of financial burden on the government. They are doing a lot. Even the national health scheme, they are one financing it. That is not so in a developed country. Governments have a lot of responsibilities they are bearing at the same time. Even the employment, In the US and all those places they are going, it's not the government that is employing people that are going there. It's the private sector. So, but government will still fall back on them. Have they made enough enabling environment for people to even establish private clinic? Pharmaceutical materials and equipment are very expensive. Import duties at the port. How do you settle that if you want to establish one? So this problem are general, not peculiar to physiotherapy, but for physiotherapists, insufficient training institution, human resources, and then they lopsided, services. And I also want to forget about other rehabilitation services. These speech therapists, I'm not sure they are up to 20 in the whole country. I'm not sure. And you can imagine the importance of speech therapists. Children who will not speak, they will pick them up. People, adults who have stroke, some of them have aphasia, speech problem and all that. That is their work. Nobody can do it. They are the ones, doctors cannot do it. That is their own work. Audiologists and all those things. All those, it's not physiotherapists alone in the rehabilitation. There are a whole lot of people, occupational therapists. There are a whole lot of rehabilitation science that are there. So all these challenges applies to them.
Thank you. I think all of us are eager to ask a question, but let me take my last question from you, madam. And I'll take your questions on paper later. Please, let's go.
Yeah, mine is a contribution. I think doctor has said much, and then the other gentleman too. So I'm a medical phytotherapist by profession. I practice herbal medicine for more than 15 years now. And then I was also trained at KN University. So as it said, there's an institution that is training. Then the regulatory body is the Traditional Medicine Practice Council. As of 2011, there was a policy to integrate herbal medicine in Ghana Health Service facilities. So that has also been running. We have about 52 now, including police hospital, my own facility. And so I believe that this forum needs a little bit of enlightenment at that aspect. So we have social-cultural dimensions of health. No matter where you find yourself, here in Ghana, there's a traditional aspect. It is part of our culture. So there are people who will always prefer traditional medicine. So with the regulation, there's a practice and then the premises, which the council is actually working very hard on. Then the product is regulated by Food and Drugs Authority. So if the person goes through FDA and they have that approval to advertise their product, then they come onto the television, it's all about money. And then the radio and then the TV, they also need their money. Then they play their adverts. So we are doing a lot of advocacy because we are professionals. We have been trained and gone through about 6 years of training. So we know what is actually wrong with you when you come. We give a diagnosis and then we prescribe the appropriate herbal medicine. And so about 52 all around the country. Each region has at least 3. Greater Accra has about 9. Police Hospital, Legma is there, Gan West, Gan East, Gan North, Tema Polyclinic has, Tema General has. So we're all around. So if the person prefers traditional medicine or herbal medicine for that option, I believe that alternative is there. Yeah.
Thank you so much. I was going to ask a question, but time will not allow me. I saw a TV advert, a woman seated nicely, and now what do you say to those people? But we'll come to that later. Some of the adverts, I think traditional medicine should make sure you stop it right now. Thank you so much. Let me see back to you.
It has been very interactive. We thank you. If you have further questions, suggestions, recommendations, you can send it to our website. So we are here to honor our panelists. They've done an awesome job. We're talking about traditional medicine. Ridge also, we offer traditional medicine, Ridge Hospital. So if you want to have access to traditional care, you can also visit the Ridge Hospital. In no particular order, I want us to honor our panelists. They've done a great job. They've supported us. When we sent out the messages, they did not deny us. So today we are here to say a big thank you, Ayuko, to them.
On behalf of the Oxygen African Health Forum, we'd like to extend our appreciation for your valuable contribution as a panelist at the Oxygen African Health Forum. Madam, your experience, your opinions, your insights has helped to advance our understanding. To you, CNO Amy Agote, we thank you. On behalf of the Oxygen African Health Forum, would like to extend our heartfelt appreciation for your valuable contribution as a panelist at our maiden health forum. Your insight, expertise has added a significant perspective to the discussion, and we truly appreciate your participation. To you, Professor Idowu Ajediran Ben, we thank you. Your contribution to this panel's discussion has advanced our understanding of the challenges we face in healthcare in Africa and the potential solutions that are there to correct some of the gaps. Your thoughtful responses to questions and comments from the audience were insightful. Dr. Gladys Akosua Brewer Niyama, we thank you. And thank you all, panelists.
Thank you all. Please, we can do better for them. Let's clap our hands for them as we usher them down to their discussions. Please kindly.
Please pick their citations for them. Someone should pick it.
We are really grateful for your participation. Please, a survey has been sent to our phones and emails. Let's kindly fill the survey and then submit it. We'll have a short interlude as we move on to the next section of the program. But as we have the short interlude, I would like us to recognize a member, a dignitary among us. Already we've seen him giving contributions, but we might not know who he is. He's stepping in the shoes of our Honorable Minister of Health, Professor or Honorable Ajiman Menu. Today he couldn't make it, but he has given the mantle to a key personnel, and he's no other person than Dr. Ewua Bewua. He is the Acting Director, Technical Coordination Directory of the Ministry of Health. You've seen him already. No wonder he was talking so much about policies and economy. He is there. Now we are moving on to the next section. We have an interlude, and then we would have a speech by our co-founder, CEO, who is called Abdul Salam Muhammad. But as he comes, we have a short interlude, and then we will refresh ourselves. Not by going out, but just release tension, and then we continue. We are almost done. By the way, my name is Linda Anakweye, and I am the local content manager for Oxygen Health Connect. I'm also a midwife at Reach Hospital, and also I am the Corporate Affairs Manager of Corporate Health Ghana. Enjoy the rest of the program.
COVID-19 has caused the biggest global disruption, exposing the inadequacies of the traditional health system, making access to quality, safest, and professional health care the most critical commodity. Now more than ever before, with the rising burden of chronic and communicable diseases, we need new approaches for healthcare delivery beyond the traditional hospital setting, which is largely congested and inadequate. Globally, COVID-19 has accelerated the need for digital and virtual healthcare. This COVID-19 disruption has led Corporate Health Ghana to make a giant pivot into a digital healthcare, creating a robust digital health marketplace.
Prior to COVID-19 pandemic, our business was basically home care health services. Then COVID came. There was lockdown and the business was negatively impacted. We needed to innovate around it. And we felt COVID came with new opportunities in terms of virtual care and digital healthcare services. So we responded by developing the Oxygen Health Portal, which is a digital health marketplace connecting patients with health professionals and resources closest to them within digital platforms.
What we've done is to simplify the cumbersome process of seeking healthcare service through digitalization and to offer the opportunities for patients and clients to request and then receive various healthcare services such as home care, telemedicine, medical errands at their convenience of their homes or phone.
The state of healthcare delivery in Ghana, just like many developing countries, is appalling, with many lives lost due to overcrowding, a worrying phenomenon that has been termed no-bed syndrome. Without integration of digital and virtual healthcare, the SDG goals of improving access to quality healthcare and universal health coverage by 2030 cannot be achieved in Ghana and any other developing countries. The future of healthcare is digital, and Corporate Health Ghana has taken a bold step in investing in developing cutting-edge health technology infrastructure for the future. The Oxygen Health.
The Oxygen Health Technology Suite is an innovative integration of disruptive features of several technologies, such as the USSD, the IVR, the AVM, the mobile app, the web app. This integration makes our platform robust, smart, and dynamic, addressing patient needs.
Our goal is to lead in the digitization of healthcare services in Ghana and Africa. What we need now is actually investment and funding to scale up so that we can send healthcare to many communities and many underserved populations in Ghana and Africa.
The Oxygen Health Portal, with the required investment, is projected to provide healthcare services to over 1 million clients by 2025.
It did not take a year, a month, or two. It took us as long as 8 years to get to where we are today. This vision has been an intangible one for a long time, but now it has become tangible. Led by the CEO, the co-founder of Corporate Health Ghana Limited, an organization dedicated to improving healthcare through digital innovation. We have the person I'm about to introduce have been awarded the Presidential Business Pitch Award in 2018. He is the Principal Nursing Officer with a background in nursing, informatics, leadership and business management consultant. He is also the Administrative Secretary and also the Nursing Audit Unit at the Kolebu Unit, the Nursing Audit Unit at the Kolebu Teaching Hospital. He is no other person of Abdul Salam Muhammad. He's the Principal Nursing Officer. He is the leader of the Oxygen team. We also have Michael Asante. We have Anita Fixon, who is the Customer Care Service Provider. Then we have Isaac Guachimelu, who is also one of the technical or software developer. It has been a long journey. Oxygen Health Connect, Oxygen Marketplace, and then the USSD has been developed by these great men to solve the problems of the healthcare system, bringing innovation through digital means to help answer questions of our day. Healthcare will never be the same as the great minds have put together a great solution to answer questions pertaining to healthcare services. Now, healthcare is more easier and more amazing to use as we have a product to announce to you. Thank you so much. I will invite our CEO, co-founder, Abdul Salam, Principal Nursing Officer at the Kolebu Teaching Hospital, to give us a small keynote address, and then we proceed. Thank you. CEO, welcome.
Apostle Nitego Tego, the board chairman and moderator of Oxygen Africa Health Forum. Dr. Balfour Ewia, the acting director of Technical Coordination Directory, representing the Minister of Health, Honorable Kweku Ajiman. Dr. Francis Chisaka Solo, the World Health Organization country representative, who is currently joining us virtually. Madame Bonnie Barnes, the co-founder of Daisy Foundation International, she's also joining us virtually. Sheikh Khalifa Abdurrahman Shaban, esteemed guests, experienced panelists who have just shared with us very insightful information, captains and managers of health, distinguished colleagues in the healthcare profession, stakeholders, members of the media, and all those who have joined us today. Today is truly a remarkable day for me and for my team. As we launch and introduce Oxygen Digital Health Marketplace. Ladies and gentlemen, this day is not just about the launch. It is about the story behind our success. From a spark of inspiration 14 years ago, at a similar event like this, the idea was incubated. Our idea has undergone several iterations, and we have overcome countless hurdles to arrive at this stage. It is not just a platform, but it actually represents a testament of the power of perseverance and passion. Ladies and gentlemen, about 14 years ago, I heard an incredible story about a black community in Israel called Dimona, and how that community has succeeded in eradicating diseases and improving health outcomes. That story was told by our late Minister of Health, Honorable Major Orich Oshiga. The passion with which he spoke about Dimona and the regenerative health policy left an impact on me. In fact, a very lasting one. I kept asking myself, if a black community in Israel could do it, what about black African population in Ghana and other African countries? So with this inspiration and passion, as a nurse working in the health sector, seeing all the challenges, I founded Corporate Health Ghana, focusing on home care and medical screening. Unfortunately, or fortunately, when COVID came, the business went down. I wanted to leverage technology. Then I decided to approach this wonderful, young, hardworking technology team. I spoke to them, I said, COVID is destroying my business, but I want to use the same COVID to leverage around technology. So we experimented during COVID. The experiment was fantastic. And post-COVID, we have forged ahead and partnered to co-found Oxygen Health Technologies. Ladies and gentlemen, today we have built a robust oxygen digital health marketplace, connecting patients to health professionals, service providers, and resources closest to them, and more importantly, automating health education in local language for rural folks by just dialing a short code without the need for internet or smartphone. What we have done is to simplify the cumbersome process of seeking healthcare. Ladies and gentlemen, the problem of healthcare in Africa is complex and multifaceted. However, an interesting story again. When we finished developing the marketplace, we realized that if we do not invest in building or in contributing to building an ecosystem of healthcare, our marketplace will be meaningless. And that is why today we have Oxygen Africa Health Forum. Because COVID taught us that without a proper integrated health system, Africa and the world will be unable to survive the next pandemic. So the Oxygen Africa Health Forum was born out of this realization and the need for us as business to contribute to us building a strong ecosystem across Africa. At the core of building integration in healthcare is the workforce, which is why we have partnered with Daisy Awards International to award 10 nurses for their outstanding contribution. Ladies and gentlemen, we have made history today. For the first time ever, nurses in Ghana and Africa are receiving the Daisy prestigious international award. We are very positive today. Apart from the Daisy Award, they will also receive the Health Heroes Awards and be inducted into the Oxygen Hall of Fame. Ladies and gentlemen, we will not have achieved all of this without the invaluable guidance and support of our board, particularly our moderator and board chairman, Apostle Utegu and Madame Alberta Roxy. We are forever grateful for your support, and history will remember your unflinching contribution. On behalf of the Oxygen Health Technologies and Corporate Health Ghana, we express our deep appreciation to Bilbo Africa, Ghana Tech Lab, the Zogo Business Incubator, the Lafia Innovation Program, Impact Hub, and the National Entrepreneurship and Innovation Program for their unwavering support in incubating our ideas, providing us business support, and funding towards the development of this marketplace. Finally, ladies and gentlemen, the future of healthcare is digital. The future of healthcare is digital. It is digital. About 50% of African population don't have access to healthcare. And the digital healthcare market size is projected to reach 11.5 billion dollars by 2025. Just 2 years from now, the market is going to grow to 11.5 billion. So there is space for all of us here to tap into it. This presents a vast opportunity for investors, professionals, stakeholders to get involved for mutual benefits, whilst at the same time we improve health outcomes. We at Oxygen Health have invested in building Oxygen Digital Health Marketplace, a very cutting-edge technology that will enable everyone seated here to have a role to play actively in the digital health transformation and marketplace. In conclusion, I'd like to invite our team. Personally, I feel today is not for me, it's for the technology team. I would like to invite our team to introduce our various technology products for you to see. And I'd like to urge each and everyone seated here to watch the videos attentively. I'm very confident that Oxygen Health will be a game changer, a catalyst for change, and a platform that will drive sustainable health outcomes, not only in Ghana, but across Africa. Thank you very much, Mr. Moderator, Board Chairman, distinguished guests, captains and managers of the health industry, stakeholders and the media for gracing this occasion. Let us join hands and work together to make healthcare accessible, affordable, and available for everyone. Thank you very much.
That is what we have integrated USSD short code, IVR, AVM technologies into our platform to offer a unique and simple solution. Users having launched just down our short code instantly receives an automated voice call in their local languages to receive essential health education to a health professional to address their health needs. Our solution is to design a bridge and provide more access to reliable health information, empowering individuals in rural areas to take control of their health with Oxygen Health Short Code. We are resolution access to health information for all Africans, regardless of their location or access to technology. Ladies and gentlemen, I will now invite you all to watch the product demonstration. Thank you.
To use the Oxygen Health Connect short code, kindly dial the short code *800 *222#. You would receive a call instantly. Kindly choose your preferred language.
For English, press 1. For Chi, press 2.
Choose the medical condition.
Wopɛ sɛ wonya nkyerɛkyerɛ wɔ asitweyare mu a, mia baako, mogya mmorosoɔ, mia mmienu, rɛbɔ mu yareɛ, mia mmiɛnsa, nhyehyɛe, mia ɛnan, ɛtiridii yareɛ, mia enum, nyinsɛn, mia nsia, awoɔ nhyehyɛe, mia nson. Wopɛ sɛ wo ne yapɔmudenfoɔ kasa a, mia nwɔtwe.
If you want to talk to a doctor or a nurse, kindly do so. It is that simple. That was introduced by Miss Anita Fixon. Next, we'll be introducing the Oxygen Health Connect by Michael Asante.
Good morning. My name is Michael Asante, and I am Enterprise Solution Expert and a part of the Oxygen team. With an overload of information available on social media and the internet, it is very difficult to differentiate between credible health information and misleading contents. Statistics also shows that there is deficiency of health education contents and information in local African languages. We understand the importance of properly managing and disseminating credible health information. That is why we created Oxygen Health Connect, a unique social media portal dedicated to providing verified health news, rules, and health education in multiple African languages, empowering Africans with essential health information. We offer users convenience, eliminating the need to spend much time searching multiple social media platforms for reliable health connect. With a network of health professionals and content providers, Oxygen Health Connect offers you access to only verified content across several social media platforms. Join our community today and take control of your health. Ladies and gentlemen, I will now invite you all to watch the product demonstration. Thank you.
To access Oxygen Health Connect, kindly visit our website or search on Google Oxygen Health Connect. Access Oxygen Health Connect, the social media for health. Enter your phone number to request instant health education in your local languages or to speak with a health professional. Click on the news item for daily news updates and happenings around the health industry. Click on Heroes to read about outstanding contributions of health workers across Africa. Click on Telegram to join our page and remain anonymous as you receive information about health. Click on Health Tips to watch essential health education videos in your local languages. Click on Podcasts to listen to health news or tips across platforms such as Google or Spotify. That's very interesting. This gives access to nurses, midwives, any health professional to just post their videos to gain a larger audience and then recognition. We will also be able to make research works, post them there. Also, we can write articles. It's a large platform for all of us. We'll be introducing the Oxygen Digital Health Marketplace by Isaac Wachimenu. Please, let's kindly give it up for him.
Good morning all. My name is Isaac Wachimenu, Technology Head for Oxygen Health. COVID-19 has accelerated the need for digital health care services in Africa. In 2021, there were over 400 digital health startups in Africa, with Nigeria, South Africa, and Kenya leading the way. But with so many different platforms and apps offering various health services, patients are often left feeling overwhelmed and frustrated. The very digital transformation that was supposed to bring simplicity is gradually leading to digital complexity. That's where Oxygen Health Market comes into play. With just one click, patients access multiple health services on one single platform that eliminates the need for patients to download multiple apps or subscribe to various platforms. Our all-in-one digital health marketplace integrates multiple services and service providers, offering patients unparalleled convenience and simplicity. Whether it's booking appointments, consulting with doctors, or accessing diagnostic tests, our platform has got you covered. And with our seamless integrations, patients can easily compare services, providers based on proximity, pricing, and ratings. With Oxygen, you have everything you need to take control of your health, all in one place. Ladies and gentlemen, I will now invite you all to watch the product demonstration for the Oxygen Health Marketplace.
To access our Oxygen Digital Health Marketplace, kindly visit our website or search on Google Oxygen Digital Health Marketplace. To access our platform as a service provider or health professional, kindly follow these steps. Create an account and log in. Enter your license details and your referee. Upload your license documents for verification. Set up your profile. Add your interest or services so that we can make a job request match for you. Now, get job listings, appointments, or attend to patients virtually and get paid. Build your digital presence. Post health videos, news, and articles to reach a large audience. Request services for your patients and earn bonuses. Access CPD resources and stay updated. To access Oxygen Digital Health Marketplace, kindly visit our website or search on Google Oxygen Digital Health Marketplace. To access the platform as a patient, kindly enter your phone number or email and register for free. Log in and enter your location. This will help us find a health provider nearer to you. Use the search bar to find the health services you need. Compare providers based on proximity, rating, or pricing. Once you have found the provider you want, make a request for home care services or book an appointment so you do not join a queue. Confirm your booking and make payments. After making payments, sit back and relax, knowing that you would receive quality health care from your chosen provider. It is that simple.
The journey has not been easy, and we give God all the praise. You would have a keynote address from Daisy, the co-founder of Daisy Foundation, Bonnie Vance, FAAN, Doctor of Human Letters. So we have to listen to him, and then we enter into the Hall of Fame. I can't wait to get there. We enter into the Hall of Fame. By then, we will be wrapping up. You'll hear interesting stories about nurses who have invented a lot of new things, such as birthing chairs, how do we even say it? Surely, accompanying surely for newborn babies. We also have those who cared for the mentally challenged during the COVID era. We have those who go from door to door, house to houses, to provide one-on-one care for those in the rural areas, and reaching the percentages of antenatal attendance from 0% to 99%, and mortality rate from 70% to less than 90%. They are doing a real awesome job there. We will have the video, a welcome address by Daisy. Daisy is an international organization who recognizes outstanding healthcare professionals and then commend them for their work done. It has been in existence for a long time, and also it has also been one of the strong pillars of healthcare services, bringing in the quality assurance and then innovation. Ladies and gentlemen, we will take a speech from Daisy. Thank you.
What a pleasure to be here. If you had told me 23 years ago that today I would be your special guest and keynote speaker at the Oxygen Africa Health Forum, marking World Health Day in Ghana, I would never have believed you. You see, 23 years ago, I was farming grapes. I had nothing to do with healthcare. No one had ever given me an honorary doctorate degree, and no one had ever asked me to deliver a keynote speech on anything. Oh, a lot has changed, because at the end of 1999, my stepson Patrick, whose picture you see behind me, died of complications of the autoimmune disease ITP. As you can see from his picture, he was not a little kid. Patrick was 33 years old. He and his wife Tina had just given us our first grandchild just 6 weeks before he woke up one morning with some strange symptoms. He went to the doctor and very quickly found out he had a dangerously low platelet count. The doctor sent him to the hospital right away, and when my husband Mark and I heard Patrick was being admitted to the hospital, we flew to Texas to spend that time with him when he was in the hospital, and we thought get a couple more days with our brand new granddaughter. But that's not what happened. Patrick got very sick in the hospital right away, and I will spare you the details of the worst 8 weeks of our lives, but at the end of those 8 weeks, he died. Well, I know all of you who are nurses have been around families like ours. We had been on an emotional roller coaster, and suddenly it was over. Now what do we do? Well, we wanted very much to find a way to keep Patrick's very special spirit alive. We wanted a way to focus again on something positive because those weeks in the hospital had been just so very dark. And we wanted a way to fill that gaping hole in our hearts that his death had left. Well, as we talked about what we could do, we kept coming back to how special Patrick's nurses were. We had expected they would be excellent from a clinical perspective, and they were. He had a very complex medical condition, and they took great care of him.
I bring you warm greetings from Ministry of Health and apology for Honorable Minister for Health. So I'm giving a statement for you. The Minister of Health is pleased to address you all on this important occasion of World Health Day, as we gather here at the Hospital Africa Health to reflect on the state of health to acknowledge the progress we have made in improving the health outcomes of our people in recent years. However, it's also important to recognize we still have a long way to go to achieve the mission of health for all. The COVID-19 pandemic has brought to the fore the need for a robust health system that can withstand shocks and ensure access to quality health service for all. It has also highlighted the inequalities in our health system and the need for a more equitable distribution of health resources. As we continue to respond to the pandemic, we must not lose sight of the other health challenges that we face in Africa. Maternal and child mortality, infectious diseases such as malaria, HIV/AIDS, and tuberculosis, as well as non-communicable diseases such as cancers and diabetes, continue to pose a significant threat to the health of our people. To address these challenges, we need to invest in our health system and ensure that they are responsive, resilient, and sustainable. We need to strengthen primary health care and ensure that it is accessible and affordable to all. We need to invest in health infrastructure, health personnel, and health technology. We also need to work towards achieving universal health coverage, where everyone has access to health services they need without suffering any financial hardship. This will require a concerted effort from all stakeholders, including governments, development partners, the private sector, and civil society. As we reflect on the theme of this year's World Health Day, building a fairer, healthier world, let us remember that health is a fundamental human right and a prerequisite for sustainable development. Let us redouble our effort to build a health system that leaves no one behind and that ensures that everyone has the opportunity to live a healthy life and a productive life. In closing, let me repeat my commitment to working with all stakeholders to build a better, fairer, and healthier world for all. I wish you all a productive and insightful African Health Forum and a happy World Health Day. Thank you very much.
We have a citation for the Minister of Health, and once his representative is here, we'd like to call you back onto the podium to see what is there. Thank you.
Thank you very much. Let me give you a brief about DAISY Foundation. DAISY Foundation is an international foundation based in the US that harnesses nurses and midwives for extraordinary compassionate care. Listen to it. Extraordinary compassionate care. So anyone who is being honored by DAISY should have presented herself or himself in an extraordinary way, and a patient would have chosen the honoree. All honorees are chosen by patients, they're not chosen by DAISY. And I am the African rep of DAISY Foundation. And also, because I'm coming from Ghana, Ghana happens to be the first place to receive the DAISY Awards. Going forward, Daisy Awards will not just be for nurse and midwives, but be for every category of every healthcare professional, be it doctors, radiotherapists, physiotherapists, and all. So next year, our awards will go across every category of healthcare profession. But for this year, we are starting with nursing and midwifery. And we are going to honor 10 outstanding nurses and midwives today. And I believe as you see what we give them, it will inspire you to also do more in your facilities. Thank you.
If these car owners are here, kindly move out to park for others to go out. JS 150816, JW 473315, JS 828821. Please, if your car is here, kindly move out and park well for us. Please, Professor Bello, kindly join us up front. Please, we are up now to give the awards. The first person to be inducted into the Hall of Fame. Before that, I recognize the presence of Nana Efua Intiwa II. The first person to be inducted into the Hall of Fame as Oxygen African Health, Miss Cecilia Ama Ampedu, which is a midwife, health innovator. Please, let's give it up for Miss Cecilia Ama Ampedu, retired Principal Midwifery Officer from the Ministry of Health Ghana, is a beacon of inspiration and heroism in the field of maternal and neonatal health. Her exceptional contributions have revolutionized childbirth in Ghana and earned her global recognition and numerous awards. Ms. Ampedu's visionary approach to childbirth led to the development of a sitting and squatting delivery chairs, which her innovation has not only empowered women to choose their preferred birthing positions, but also significantly reduced maternal and neonatal complications and mortality. The chairs have been used successfully without complications, morbidity, or mortality in the 9 regions of Ghana. Ms. Ampedu's invention has gained international recognition as a best practice in maternal health, with her chairs being adopted as one of West Africa's organization's good practices for maternal health, certified by Drugs Authority, FDA, and even recognized with a citation at the 2nd National Nurses and Midwives Leaders and Managers Conference in Ghana. If I'm to go on, we wouldn't stop.
So we to present her with a badge of honor. A badge of honor from Daisy Foundation International. And a certificate, Daisy. And a sculpture called the Healer's Touch, made in Zimbabwe for her. The Healer's Touch. Thank you. And then we also have a citation for her from Oxygen Health, inducting her into the Oxygen Health Forum Hall of Fame. You are now being inducted to the Oxygen Health Hall of Fame, Madam Cecilia Ampedu, for your outstanding work and innovation. Thank you. Thank you.
The second person to be inducted into the Hall of Fame is Mrs. Aisha Bawa. She's also a midwife and inventor. Mrs. Aisha Bawa is a dedicated and passionate midwife who selfless service health in the country. She is currently pursuing a specialty in neonatal midwives. Aisha's dedication and commitment to maternal and neonatal health service has seen her become a facilitator for Women's Health to Work and PATH organization, where she trains healthcare providers on how to help babies to breathe at birth and to also thrive. She is also passionate about primary health care, and she educates pregnant women in less privileged communities on safe pregnancy and delivery, as well as early childhood during antenatal care. Aisha's innovation in the healthcare sector are remarkable, as they have made a significant impact on the lives of many mothers and newborns in Ghana. She designed a transport trolley to transfer blue babies to the NICU while ventilating them, reducing the rate of neonatal mortality to care facility. So she invented the trolley for transporting babies to the NICU.
So on behalf of Basic Foundation, we present you this Village Catch, Aisha Bawa. Congratulations. And you also have this bag. And when you go back, you have this at your facility to show that you can open up for her, to show that indeed you are a Daisy honoree. One thing about Daisy Awards, we give grants to our honorees and scholarships for further study. So you can have this at your facility to show that you are a Daisy Award honoree. Congratulations. We also induct you into the Oxygen Health Hall of Fame. Aisha Bawa, you are now inductee into the Oxygen Health Hall of Fame. Thank you. Next person.
The third person to be inducted into the Hall of Fame is Ruth Sally Koda. She is a midwife and she's a health educationalist. Ruth Sally Koda is a true hero in the field of nursing and midwifery. She has a program that is called Sally Sticks for Expectant Moms, which has yielded results and reduced maternal complications, as her impact has been felt across multiple platforms in Ghana, including Adult FM, Star FM, ETV, and Amasaman TV. Thank you.
So we give you a Daisy badge of honor, and indeed it's fascinating. She just delivered a bouncing baby 2 days ago, and yesterday happens to be her birthday. Thank you and God bless you. We also give you a certificate from Daisy Foundation, and also we give you a healer's catch sculpture made in Zimbabwe. And Daisy Foundation ordered this from Zimbabwe just support the economy of the Zimbabweans, so that by manufacturing this, they will make money. Thank you for coming. We also induct you into the Daisy Award. When you go to your facility, display this to tell everyone that you are a Daisy Award honoree. God bless you and thank you for coming. We induct you to the Oxygen Health Foundation Hall of Fame. Thank you.
Is Josephine Riapia Atokipe. If I don't say it, God forgive me. She's a nurse with a track record of her receiving the prestigious Presidential Award and State Honor for her exemplary role in COVID-19 case management. So when the COVID came, she was the front liner. Without fear and panic, she faced the COVID head on. When everybody was scared, she was the only one who accepted the role.
Thank you for coming and for all the exemplary character you've shown as a nurse. We give you the Daisy badge. And also the Daisy certificate. This is from Daisy International, organizing your compassionate care during the COVID-19 era. You were outstanding. Also, we give you a sculpture made in Zimbabwe. It's called the Healer's Touch. And we give you a hanger. When you go to your facility, make sure you can even carry it on your car and hang it wherever you are to show you are a Daisy honoree. Thank you. You may also have this as a wipe. So let me call on Professor Bello to do us the honor right now. Daisy and Oxygen Health congratulates you. Thank you, Madam Board Member. Now, the next will be from Professor Bello. Elizabeth Nana Hansen.
Clinical excellence. Elizabeth Nana Hansen is an unsung hero and a true legend in the field of nursing. And it is no exaggeration to say that she is one of the most exceptional healthcare professionals in Ghana. In the field of burns, she's good at treating burns, no matter how extensive the burns are, she will do it.
For your astounding service within the burns unit, and your patients said you were so compassionate, your presence gave them hope. Daisy awards you with a badge of honor, a certificate. Elizabeth, this is for you, and a Healer's Touch sculpture. And also, you have this hanger to show at your facility that you are indeed a Daisy Award honoree. You have also, by this, been inducted into the Oxygen Hall of Fame. Thank you. Can we give it up to her, please? Next honoree.
She's a nurse and her track is community impact. Sarah is an inspiring and exceptional nurse whose dedication to improving the lives of homeless, mentally disabled patients during the COVID-19 pandemic has been nothing short of heroic. So during the COVID, she gathered the mentally challenged on the streets and gave them education on how to prevent themselves during the COVID-19.
Mental health nurse who thought of the men on the street we've neglected enough, got them together and gave them hope during the COVID. I don't think anybody thought about empowering the mentally challenged in our society during the COVID era. We're all thinking about ourselves, but she thought about those on the streets. Congratulations, and I love mental health. You know that. That's your certificate. God bless you, Gloria. You are now a Daisy honoree. And this is your sculpture, the Healer's Touch. You work with Shai Osudoku. When you go, hang this one there. The Shai Osudoku Hospital. When you go, hang it there. I think there are two. You take one out. Let's give it to her. Thank you. Gloria, next person.
Next honoree Doris Kokoro. She's a nurse and she has a track record in clinical.
Doris Kokoro, if you are there, please, let's have you upstairs.
She moved from personal relationship to interpersonal relationship with her clients and moving antenatal attendance from 0% to 100% in her district.
She works with the Greater Accra Regional Hospital, outstanding care. Most patients who have gone through her will always say one thing: you are indeed a Forest Nightingale of Ghana. This is your badge of honor. From Daisy Foundation, we recognize your outstanding, extraordinary, compassionate care. Thank you. And this is a certificate becoming a Daisy Extraordinary Nurse and Honoree. You also have your Healer's Touch sculpture. From Daisy Foundation International. And this is your hunger for your facility to know that you are indeed a Daisy Foundation honoree. Congratulations to you, Madam Doris. And you have by this been inducted into the Daisy Hall, into the Oxygen African Health Hall of Fame.
Our next honoree goes to Miss Angela Shakasu. She's a member
Angela Shakasu.
and her track record is community impact.
Prof, thank you. You may take your seat. Thank you.
Angela is a true champion for the most vulnerable in the society. As a midwifery officer stationed at the Aberdeen Chief Zone in the Accra North District of the Volta region, Angela embodies the true meaning of heroism. She is the beacon of hope for pregnant women and children in the community, and also serves an underserved community.
The first time I saw this lady, her uniform wasn't white. Half was brown with mud, half was white. She fell in the mud, just rushing to go and deliver a woman in the village, in the Volta region. Angela, you deserve this award. This is your badge of honor. And this is a certificate of honor from Daisy. You deserve the award indeed. For your outstanding contribution, she brought antenatal care from 0 to 90% in the village by just giving gifts to mothers and children just for 10 minutes. She's an outstanding midwife. This is to show that you have been honored by Daisy. God bless you. Akpasia. Akpemanaira. Angela. God bless you. Wipe your sweat. Next, you have by this also been inducted into the Oxygen African Health Hall of Fame. Congratulations. Next.
The next honoree is in one-time job in Nan Johnson. I don't know if I will share the name.
It's Lance Corporal, right?
Yes.
From 37.
Yes.
We salute you, sir. Go ahead.
He is an exceptional nurse who embodies the true spirit of sacrifice and dedication. With close to 7 years of experience as a nurse, Johnson has gained a wealth of knowledge and experience in the field. He obtained a BSc in nursing from Central University in Ghana. He has proven to be a dedicated and committed nurse who can always be counted on to step in everywhere in the world and everywhere at any time.
When we went to 37 village hospital searching for a compassionate nurse, it took their head of nursing a second to mention Johnson's name. He said, Lance Corporal Johnson is the one we go for. And indeed, when it comes to compassionate care, Johnson stands out. Lieutenant Corporal, we salute you for this award. Daisy awards you. This is your Healer's Touch sculpture. You deserve this. Congratulations. And hang this on the doors of your ward to show that indeed you are a Daisy honoree. You are a Daisy honoree, you deserve it. Congratulations. And by this, you have been inducted into the Hall of Fame of Oxygen African Health Forum. Congratulations, Joseph.
The next honoree.
Joseph.
The next honoree, Mrs. Amy Akote. She is the best. The track is leadership is excellence. Mrs.
So I'll call on Dr. Wia to do us this honor. Dr. Wia, please do us this honor.
Mrs. Amy is a true healthcare hero whose unwavering nursing excellence that sets her apart as a leader in her field. As the Chief Nursing Officer and head of the audit unit of the Nurse Tertiary Directorate at College Teaching Hospital, she has been an instrumental in ensuring the highest standard and quality and safety across the board.
You deserve a Daisy, Queen of Honor, Miss Amy Akote, and also a certificate of honor from Daisy Foundation to you, recognizing your extraordinary care and leadership of the nursing fraternity in Kolebu. We also give you a healer's patch from Daisy Foundation International for your extraordinary care and leadership qualities, and this hunger for your facility. Congratulations, Madam Amy Akote. Congratulations. By this, you have been inducted into the Oxygen Health Africa Hall of Fame. Congratulations and thank you for coming. So can we have all the awardees on stage to have a picture with our Honorable Member Minister's representative from the Ministry of Health. All awardees, please come up stage. All awardees, please come up stage. All awardees, please come up stage. Dr. Gladys Nyama join us here, if she's around. All awardees, please let's stretch towards here. Let's do a good sandwich, interspace with men and women. All our teams. Where's the photographer? You can arrange better than I can. The shoulders at the back. All awardees and the board members and the minister's rep, and I am the Daisy rep. I should be part of it.
Not too soon, we have to come to the end of
Thank you.
Thank you so much. Thank you to our invited
Thank you. Thank you, everyone. Thank you.
Honoring our invitation. Thank you to the Sika dance troupe from English Amount Pro. We thank you, social media managers. We thank you, the media, UTV, City TV, TV Africa, and all the other media I couldn't mention. We say we are grateful. We will call. I did not introduce this man because the best wine is left later. I will call on Sheikh. Let me take time to pronounce the name. Sheikh Khalifa Abdul Rahman Saba. He's a spiritual cleric for Fahaitu Tan. Like the rest, I will end it here. So I'll kindly invite Sheikh to give us a closing prayer. Thank you so much.
Sheikh Abdul Rahman Shaban. And then the one she couldn't mention. That's very little Ibrahimian Council. Thank you so much for coming to me today. It is Assalamu alaikum wa rahmatullahi wa barakatuh. Peace and blessings to everyone here. It is an honor to stand before you all here at Oxygen Africa Forum. very grateful for this opportunity as a spiritual leader. I believe that true healing comes from not just from medicine, but also from the power of faith and praise. We must remember that Allah is the ultimate healer. And at this point, I said, oxygen, please include us pastors and imams into your portal. So that when somebody says, if you need healing by prayer, so include us in there. I pray for you for your outstanding work. So, through His Allah's mercy and guidance that we overcome any obstacle. I always commend and celebrate health workers, especially nurses. I had a situation where I'm in Ghana here. I happen to be in New York. And I'm in Ghana here, and my wife is giving birth. I left here at night. By the time I get to New York, my wife has already given birth. And she was treated by these nurses. It was excellent work. I will never ever forget. No family was there, nobody was able to go because it was very urgent. But when I got to the hospital, my wife was so comfortable. These nurses has made her so comfortable that I will never ever forget this. I thank you all. You all are wonderful people. So today I have the opportunity to pray for you as a spiritual leader. You guys have suffered tremendously during COVID-19. And a lot has happened. And with your great work and dedication, you guys have stayed put. Even though with all these challenges, nurses and doctors, all health workers, you all were very great. And we thank you so much. I take this honor and support you in every way possible. And I directly pray for you today. May Almighty Allah bless the soul and all health workers who died to COVID during professional duties. And those of us here, may Allah Almighty grant you heart desire. At this juncture, I will pray in Arabic as a Muslim and as an Imam. May everybody help me in this prayer. آمن الرسول بما أنزل إليه من ربه والمؤمنون كلهم آمنوا بالله وملائكته وكتبه ورسله لم نفرق بين أحد من رسله قالوا سمعنا وأطعنا غفرانك ربنا وإليك المصير ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا إننا سمعنا مناديا ينادي للإيمان أن نؤمن فآمنا ربنا فاغفر لنا ذنوبنا واغفر عنا سيئاتنا وتوفنا مع الأبرار اللهم اغفر حينا وميتنا وكبيرنا وذكرنا وأنسانا وقرنا وعبدنا وطائنا بارنا وعصينا الله فاتحة بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. May God bless you all. I thank you so much. Have a good day. Thank you.
you all for coming. We appreciate you and hope to see you in December for our second forum. Thank you so much.
In providing basic and essential services,